My name is Vincent Jongkind. I'm a consultant vascular surgeon based in the Amsterdam University Medical Center. In the current guidelines, and they're actually already from a couple of years ago, but I think they're quite clear in advising to preserve the LSA if possible. We do have a lot of data, for instance, from the VQI, and what you see over there in that data is that actually preserving the left subclavian artery or revascularizing it really lowers down some very important complications. I think indeed if you look at the data that's out there, that if you cover the left subclavian artery, you take a risk of increased risk of neurological complications, be it spinal cord ischemia or be it stroke. What is actually very interesting is that quite often the risk of arm ischemia is not that high. It depends a bit on which cohort you're looking at. That tends to be not the biggest risk. If you would not have this off-the-shelf solution, then it would be a bit more difficult actually to preserve the left subclavian artery. So either you have to order a custom-made graft well in advance, which comes with extra time and extra costs, or what you have to do is to do a two-stage procedure or a bigger operation in one time. So first you have to do then the endovascular procedure and then continue with an open surgical procedure to preserve the left subclavian artery, which I think at least lengthens the time of the surgery, but most probably will also increase the risk of the surgery. The long-term results of a left subclavian bypass are good, but still we see some loss in patency. And I think particularly what you see is that you have the risk of phrenic nerve injury. And the risk is not particularly high, but still you see some percent of patients having that phrenic nerve injury. And what you have is of course the wound complications, you have the bleeding complications, and also the lymphatic problems you can have after doing that bypass. Still a carotid subclavian bypass. It's a serious intervention you're performing with inherent risks. What the difficulty is, if you don't have any ready available options for preserving the left subclavian artery, that's in some cases you will need to cover it. Or you need to do an extra operation to preserve the left subclavian artery. And that of course takes time, sometimes an extra operation. That would mean that patients sometimes have to wait for the definitive repair. And I think if it's nice if you really have an off-the-shelf solution so that you can really have a very low threshold in preserving the left subclavian artery. And thereby of course the goal is that we improve the outcome of our patients. And that has to be seen, of course, with the data later on. But I think it's really exciting that we're going to have that possibility already now.